House Bill 98, clerk will read.
Representative Biggs, Hardister, Neal Jackson, and Lambeth. House Bill 98, a bill to be entitled Medical Freedom Act. The General Assembly of North Carolina enacts.
Gentleman from Randolph, Representative Biggs, recognized to debate the bill.
Thank you, Mr. Speaker. House Bill 98 is the Medical Freedom Act. Some people, as we debated it throughout the committees, we've discussed the fact that it is not a ban on the COVID-19 vaccine. It is just giving people an option. We work diligently with DHHS, as you can speak with Matt Gross and different ones. We work with UNC Health to make sure we covered all their concerns. And I will now give you a brief summary of it, and then I'll stand for questions. House Bill 98 will prohibit state agencies, local governments, and political subdivisions from discriminating against individuals based on a refusal to provide proof of or submit to a COVID-19 vaccination unless the vaccine is required for employers in a facility certified by the Federal Centers for Medicare and Medicaid Services. It is required as a condition of the entity receiving federal funds, or it is required for employees of the Department of Health and Human Services, Division of State-operated health care facilities. It also prohibits the Commission for Public Health and Public School Units, community college, and constituent institutions of the University of North Carolina from requiring a student to provide proof of COVID-19 vaccination or to submit a COVID-19 vaccination or series of vaccinations unless required for the vaccination or proof of vaccination is required for participating in a program of study that requires working, volunteering, or training in a facility certified by the Center for Medicare and Medicaid Services. This bill, like I said, will give people the option. We found out that, I think all in good faith, a lot of people, we rush things. We really pushed it, like I said, in many committees. It was called Operation Warp Speed, and when you're dealing with medical things like that, I think there still needs to be more studies. I think the warp speed, I think we went a little too fast. We pushed it on every single one, and it's not intended for everyone. It's not a one-size-fits-all, and we just want to give the people the options while still covering our health care facilities. I appreciate your vote.
Further discussion, further debate. For what purpose the lady from Wake, Representative Sylvania, rise?
Speaker, to debate the bill.
Lady has the floor to debate the bill.
Many of you do not probably know, many in health committee do know, that I'm an epidemiologist and a biostatistician. My whole career is to save lives through pandemics and through disease. I want to say, pragmatically, medically, we experienced the most unprecedented time during the pandemic for COVID-19. We did not know when we started out in trying to deal with protecting our people what to do. And I will agree with my colleague here, in the beginning times, it felt like warp speed. But I will tell you this, in the science of it, the vaccines were actually created already. I worked in public health during SARS and avian flu. COVID-19, the top portion was created to where it can address this virus. So I do agree to what, at one point in time, that it was warp speed. We're 3 years out with a lot of research, and we've seen a lot of good things, and we've seen a lot of death. We have not, and we've debated this in committee, and there has been good numbers with our kids when it comes to saving their lives. There's not a lot of deaths, but we have to keep in mind, we did implement washing of hands, social distancing, having kids not go to school for a matter of time, quarantining, and ultimately vaccines. To say it's a discrimination to choose not to show proof of vaccine, when we're trying to control outbreak and death, in my field, and I think in a lot of other medical fields and public service fields, is derelict to my professional and to medical professionals to not try to prevent more deaths if they can. We have EOC protections already, protecting religious and medical exceptions. I believe that we should just be enforcing this and not adding an extra layer. And ultimately, our local and county governments should be recognized in making the right decisions and continue to be trusted in doing so when we have to face these dilemmas. I urge my colleagues not to vote for this bill and really trust in the science and professionals in making the right decisions when it comes to medical science. Thank you.
Further discussion, further debate? If not, the question for the House is the passage of House Bill 98 on second reading. Those in favor will vote aye. Those opposed will vote no. The clerk will open the vote. Representative Bell. Bell, aye. Clerk will lock the machine and record the vote. 72 having voted in the affirmative, 42 in the negative. House Bill 98 passes second reading without objection. Be read third time.
The General Assembly of North Carolina enacts.
Question for the House, passage of House Bill 98 on third reading. Those in favor will say aye. Aye. Those opposed, no. No. Ayes have it. House Bill 98, having passed third reading, will be sent to the Senate.